Hi, my name is Dr. Daller and I'm a urologist in beautiful Southwest Florida. Today I would like to share with you my method and experience in pain-free intramuscular injection of testosterone cypionate. This technique is useful for any intramuscular injection therapy. I had chosen the thigh muscle, also known as the quadricep muscle, as the most convenient site for self-administration. I have Kelsey here with me to help with this demonstration, starting with washing your hands and gathering your supplies.
We have laid out everything that you need for self-injection. You will need 3 alcohol prep pads, one 1 milliliter Luralock tip syringe, one 30 gauge by ½ inch needle, one 18 gauge by 1 inch needle, and your testosterone cypionate. This specific vial comes with 200 milligrams per milliliter. The first thing that you're going to do is open your supplies in a sterile fashion. The specific areas that you do not want to contaminate are the tip of the syringe, which is here, and the hubs of your needles, which are here and here. To avoid contamination, make sure that you open your supplies from the proper end of the packaging. Find the ends of the plastic where they easily separate and open them similar to when you open a Band-Aid, just like this. Keep them in the packaging and set them back down. So next, open your vial of testosterone. Remove the cap from your vial and clean the top of your vial with an alcohol prep pad. Take your syringe and attach it to your 18 gauge needle by twisting. Then you're going to prime your syringe just like this. To avoid a negative vacuum effect, you want to fill your syringe with the amount of air that you would want fluid coming from your vial. So for this demonstration, we're going to use a ½ cc, which is equivalent to ½ of a milliliter. So we draw up like this, and you want to measure to the top of this black plunger. Remove the cap from your needle, and you want to inject the air into the vial. So find the center of this gray circle right here. Stick your needle in and inject the air. Now what you want to do is turn your vial and syringe upside down, ensuring that the tip of the needle is still in the fluid that you want to aspirate. So now, since we're doing ½ of a cc, we're going to do the same thing that we did before. Pull back to the top of the plunger. You might want to do a little bit more right now. And there's air at the top. So we keep pulling back. And then inject until the top of that black plunger gets to ½ of a cc. Okay, now remove your needle from your vial, like this. What you want to do is you draw in some more air to ensure that any testosterone that is left in this needle right here is in your syringe. So we pulled back some air, cap this needle, and now attach your 30 gauge needle to the syringe. Remove your cap, and then what you want to do is push all the air out of the syringe until you see a drop of the testosterone come out of the tip. What this will do is lubricate the needle to ensure that it's a painless procedure. So we keep pushing the air out, and I see a drop coming from the needle right like that. Now set your needle down so that you can prepare your injection site. Now you want to prepare your injection site. First, you want to divide your leg by thirds using your hands. So you place your hand here and here. Next, draw an imaginary midline down the center of your thigh, and you want to go lateral to this line. This right here is your vastus lateralis muscle. This is what we consider the safe zone. So you want to find this area and use an alcohol prep pad to clean the area. And we have Mr. Long here who is going to be our demonstrator for a self-injection. It's very important that you are in a comfortable seated position to make sure that your muscle is not contracted. Next, you want to hold your syringe like a dart. Find the area that you would like to inject on your leg and hold your fingers to where your skin is tight. Next, hold your needle at a 90-degree angle to the skin and insert into the thigh. Stabilize the syringe with your non-dominant hand as you inject the testosterone with the other. Normally, testosterone is thicker than B12, which we are using here, so it may take 8 to 10 seconds for the injection. Once you've injected all of the fluid, remove the needle. Apply pressure for 20 seconds, and then recap your needle and dispose of your needle in the proper sharps container.
If you have any questions about the signs and symptoms of low testosterone, such as fatigue and low energy, erectile dysfunction and low libido, increased body fat as well as difficulty losing weight, difficulty to focus, concentrate, as well as problem with memory, please consult your healthcare professional to see if you are a candidate for testosterone replacement therapy. I would encourage you to go to our website at drdaller.com to learn more about testosterone replacement therapy. I would encourage you also to subscribe to this YouTube channel, and I promise to post one video every week about healthy living. The best advice I ever got was that knowledge is power, and the best source of power is experience. So please post your experience as well as questions so we can all continue to learn.
This video is for educational purposes only and is not a substitute for proper medical evaluation.